Good day, everyone, and welcome to our online recorded webinar. My name is Elsie. I'm a clinical educator, and my colleague Tish is a rural mental health academic advisor. We are part of the Three Rivers Department of Rural Health team, and both of us are occupational therapists by profession. We will take turns presenting the information today, which is all about preparing for rural practice. This presentation could relate to clinicians starting out in rural practice, or clinicians already working in rural practice, or students interested in working rurally. As this is a recorded presentation, there won't be opportunity for live discussion. However, we do have a Padlet site, which is a place where you can add your own reflections and read what others have said and contribute to the wider community of rural practitioners. Please also contact us if you have any questions or feedback regarding this session. Next slide, please. We would like to acknowledge the Wiradjuri people who are the traditional custodians of the lands on which we live, work, and play. We acknowledge their continued connection to culture and country and the wisdom generated over many years. We hope to continue moving towards a place of equity and justice for all people. Looking at the learning objectives today, a lot of the content that we will be covering may seem like common sense to you. We hope that this is reassuring that you already have the inherent knowledge and skill to work as an effective rural clinician. First off, we will reflect on the skills required to be an effective rural practitioner, an introduction to student supervision, particularly in a rural context, an introduction to building your capability as a rural clinician, and we will be covering some resources for rural health practitioners as well.
Okay, so let's just take a moment to think about and reflect on the skills required to be an effective rural practitioner. So just having a think, what might that look like, being an effective rural practitioner? And how would we prepare for rural practice? And this, like Elsie said, can apply if you're entering as a clinician or experienced clinician or a new graduate or even as a student. So I guess the first thing to think about is to try and understand the context and to keep up with the changes, the patterns and issues facing our community and how this fits with the broader picture of state and at a national level. Keep curious and subscribe perhaps to updates like the Rural Health Alliance. They tend to do all the hard work for us, like this infographic that really well describes the rural context. So we're just working through this infographic a little bit just to set the scene. So in generally speaking, in rural areas, there is obviously a deficit in finance from a financial perspective. There's also then that's coupled with having fewer health providers and fewer services, less bulk billing opportunities, so therefore less access to primary health care. On top of that, we've also then see a higher burden of disease. So that increases with remoteness. So, you know, we have higher heart disease, kidney disease, lung, more deaths from diabetes, more avoidable hospital admissions, and also higher levels in some areas of rural Australia, excuse me, higher rates of suicide and psychological distress. So if that's our context, how do we succeed? How do we thrive? So if we take a further look at some of the barriers and enablers of living in a rural area, we see that we've also got poorer internet access in some cases, less mobile reception. We have higher levels of unemployment depending on the remoteness. There's lower incomes, and in some cases, homelessness is very difficult. But from the enablers perspective, there's also more social cohesiveness. There's more community involvement, more volunteering. People often speak of, in the literature as well, better work-life balance. There's clearly a less traffic and shorter commutes, so we can finish work and be home generally within 5 or 10 minutes. So that gives us a lot more time for our families and our personal life. So there's some of the barriers and enablers. So if we just take a moment, if you'd like to just think about, when we're talking about what it takes to be a rural practitioner in that context with those barriers and those enablers, what might be some unique situations that and challenges that rural practitioners would face? What is special and unique about rural practice? What characteristics? What type of person? What would be their strengths? All of those coupled together, how would that come together to help that person be effective and work and thrive in a rural context? If we think about and have a look at the literature, and this is in the references at the end, Brems et al. And Burke et al., both of these resources are listed in our reference list. So Brems in 2006 indicated that the challenges in rural practice include that it's more personal and less professional boundaries. So there's overlapping roles. There's more travel, there's less resources, there's limited referral options, there's sometimes language difficulties, and patients can be avoidant of care. Burke in 2010 indicated that the opportunities of rural practice, as we've spoken about, relate to the quality of family life and the community participation, the cultural connection, but also the ingenuity, the diverse caseloads, and that concept of client cradle to grave. So the client connections with the community. So you may be able to see someone in an emergency department and also see them through their entire journey of care in an acute setting. And in the community, you have opportunities to see people through different phases of their life, or all their children or their grandmother, and it's very rewarding in that way. With regard to metro practice, these sources that we've mentioned report less intense challenges compared to the rural challenges that we're talking about today. They report that there's less opportunity to affect change at a population level. There's more specialisation, but that also then creates less scope of practice. There also may be more professional competition and more educational opportunities. But I do think with the change and the increase in telehealth and virtual offerings for professional development, that is actually working in our favour in the rural space. So if we go to the next slide, there's just a further list of the challenges, opportunities, and strengths and the traits, skills required. So like we've spoken about, serving remote locations is a challenge. We've talked about less accessible professional development in some cases, and that there's fewer services, but there's higher health needs. The opportunities, though, are that you have a varied caseload. You learn by doing, and your contributions are impactful. So you have a wide scope of practice, which is exciting and very rewarding in itself. So some of the skills or the traits that you might require, but then equally may challenge in yourself to work in a rural area or to take a rural placement and to develop in yourself might be adaptability. You have to be extremely adaptable to change and uncertainty and come up with creative solutions. We're looking at strengths. It's a strengths focused, and you're developing your resilience as a person, but also as a clinician. It's definitely required. So we invite you just to, pause the video for a second and just write down some words, phrases that come to mind as we've been speaking through this. What are some of the challenges that you might see, or the opportunities that may have come to mind while you've been listening to this? And just take a minute just to reflect. Okay. So next, you might just take note of the quote from Albert Einstein. It says, "In the middle of every difficulty lies opportunity." And I think that really captures what we're talking about today. We've talked a lot about the barriers, the challenges, the difficulties, but also shining through that is the opportunities. And we're going to just go through now just an example of that. So we've got an example from our work where two clinicians made the most of the opportunities to grow their clinical skills, increase their capacity, and expand their professional network. So this is a bit of a case study, I suppose. There was an experienced clinician, regionally based speech pathologist, who worked at a community clinic part-time. We'll call her Susan. Susan was the only clinician based at the clinic where she worked, and she had to provide outreach services as well as, and was spread rather thin. So, however, Susan wanted to give back to her profession and wanted to provide student supervision and hoped that the student might help her manage her caseload or work on some resources that can help her, everyday work. However, Susan had never supervised a student before, let alone in a part-time capacity, and wasn't sure how she would manage everything. There was also another sole speech pathologist in a neighbouring town, and we'll call her Roxy. Roxy was less experienced clinically, however, she had supervised students before. Roxy was new to the area and needed to provide outreach services at a preschool. This was the first time that she'd worked in a pediatric population in a rural setting. Susan contacted us and told us about her plans and for taking students and trying to come up with a solution. Susan mentioned Roxy. We linked in with both to see if they would share a student supervision, where the student would be placed at both the clinic and the preschool. Working together to supervise the student, Susan was able to provide support and mentorship to Roxy about working with young children at the preschool, while Roxy was able to give Susan some pointers and guidance with regard to student supervision. This was a challenge that led to an increased capacity for both the clinicians and had a positive outcome on the communities, as the extra hands on deck helped both clinicians reach more clients and improve their service provision. It was also a great learning experience for the student, who was immersed in the realities of rural practice and observed how these two clinicians worked together to make a placement a success. If you'd like to, you can pause the recording just for a moment and take a second to reflect on your own experience of a challenging situation that had a positive outcome and resulted in professional growth.
Thanks, Tish.
Yeah, over to you.
Okay, so let's focus on student supervision in a rural context now. Looking at the next slide. Rural Health Workforce Australia produced a report on allied health students' perceptions of rural versus metro clinical placements. So as you can see that there are orange bars and there are red bars. The orange bars represents the aspects that the students associated more strongly with regional, rural, or rural placements, whereas the bars in orange are more strongly no, sorry, the red ones are more strongly associated with metro placements. Sorry, I got confused there for a moment. Okay, so looking at the orange bars, which the students associated more strongly with regional placements, they thought that there is more opportunities for hands-on learning, also working in smaller teams, being given more responsibility and more attention from their supervisors. They also thought that in a regional setting, you would get to have more autonomy, learn more skills, and there would be greater continuity of care. And lastly, exposure to more complex cases. Then students associated exposure to more rare or unusual cases with metro placements. Also, they thought that those placements were more prestigious or better for those who want to specialize. They thought that there would be better facilities and infrastructure, and also exposure to the latest technology. Of course, this graph only represents the students' perceptions, not necessarily the true situation. But looking at the themes that appear to stand out with rural practice is that you get to be more hands-on and autonomous and learn more skills as a result, though you also need to be more flexible and make the most of the limitations that you may be presented with in a rural setting. Sometimes you need to step slightly outside of your area of expertise, making full use of the available resources, being challenged, and using the opportunities to learn. It is important to ask for help from your team and other staff, getting them involved as they can and bringing the team together instead of trying to work in isolation. So looking at the next slide, we will talk about the benefits of student placements. So as you can see, there are lots of benefits related to student placements, and many of these are of particular significance to the rural context. I will be highlighting just a few under each bar. So for students, placements obviously provides opportunities to develop their clinical and cultural competence. It helps broaden their horizons, and it may lead them towards a potential employment location. The research suggests that positive and quality placement experiences in rural areas in particular are associated more strongly with an intention to practice rurally in future. So if they had a great clinical placement, they might consider rural practice more than if they didn't have the placement at all. For supervisors, having students is a great way to enhance your own skills and maintain best practice. As a supervisor, you want to demonstrate that you are implementing best practice in your context, and so this keeps you accountable as well. Supervising students counts towards your CPD points, and it promotes the professional satisfaction of giving back to your profession. Supervising students can help you manage your workload, and we will discuss this under the community column. For organizations, hosting students could assist to develop a culture that embraces learning and innovation at the organization. And this is beneficial to everyone at the organization, not just the students. Hosting students also helps to maintain quality standards because, as with the supervisor, you want to demonstrate that you are keeping abreast of things and that your quality standards are maintained. It helps build the workforce because students who go on placement have the time and opportunity to decide whether they might be interested in applying for a position at the organization in future. Building the rural health workforce is the main reason why university departments of rural health and rural clinical schools exist today. And we actually utilize placement opportunities to help organizations build their workforce. As we know, rural health workforce remains a nationwide priority and a significant challenge. Communities benefit from student placements by having increased access to services to address their healthcare needs that they would otherwise not have had. Students are able to work on things like client resources, for example, educational resources, or they could implement programs that clinicians otherwise would not have had the capacity to implement. This is of benefit to the community and your client base. We have heard accounts of clinicians stating that they actually rely on students to help maintain their workload and working with clients that they otherwise would not have had the time to work with themselves. Students are able to do follow-up consultations, thus increasing the frequency of interventions or address long waiting lists. Universities and university departments of rural health work hard to allocate students to rural areas for their clinical practice in an effort to expose students to rural practice and support the recruitment to rural areas, as mentioned before. In some instances, universities identify students through an expression of interest process to try and make sure that students are actually interested in rural practice or able to handle the challenges associated with this when they come on to their placement. So they work hard to make sure that they allocate students appropriately. And it's good to remember that university departments of rural health are there to support the students and their supervisors before, during, and after the placement to help facilitate a positive experience for everyone. Thanks, Tish. Next slide, please. Okay, so looking at your impact as a supervisor, it actually is critical. Clinical supervisors who make students feel that they belong are consistently one of the most important determinants of successful clinical placements. And we see this in the literature, and we also hear this from students. As a supervisor, you are the students' everything. You are their main contact, their lifeline, their professional role model. You are their supporter, their validator, their mentor, and also, importantly, their future colleague. So it's good to have a think about what messages students get through what you do and say while they're on placement with you. Through what you model, students will witness and come to understand the possibilities and opportunities of rural practice. By modeling a strength-based attitude and demonstrating creative strategies when you are presented with challenges, and displaying positive relationships with your team members and community and other services, it helps to bring this positive message across to students. Thanks, Tish. Next slide, please. So if we think about instilling a sense of rural practice in students, how can you help them understand the unique attributes of rural practice? And how can you help them appreciate the opportunities associated with rural practice? So here are some ideas. As we have discussed before, facilitating a sense of belonging is actually one of the most important aspects of a quality and a successful clinical placement. Helping them feel that they belong will help students make the best of their clinical placement and optimize learning. This can be done by making them part of the day-to-day things happening at your organization. For example, introducing them to other staff, having them attend meetings or ward rounds, including them during social events or at meal times, creating interprofessional learning opportunities for the students, and giving them responsibilities within the team. This helps them to get a sense of the unique opportunities and the challenges related to rural practice. Also, in terms of the community, it helps to encourage them to become involved in the community by doing things such as visiting other stakeholders or referral partners, going on home visits, attending community events outside of work time. Students then come to appreciate the community's strengths and needs, and having them immersed in the community is really a valuable part of their learning, not only in terms of their placement, but also in terms of understanding rural practice. We also want to make sure that students attend high quality placements to ensure that everyone is getting the best out of each and every placement opportunity. But it's difficult to know what we actually mean by quality. It's difficult to define, but some of the features include social and cultural connections, feeling safe, having the opportunities to grow autonomy, fostering a sense of belonging, as we've talked about before, building confidence, developing professional identity, feeling welcomed and valued, and high quality supervision. as a supervisor, these are all aspects that you can contribute to. Thanks, Tish. Next slide, please. So we talked about student placements and in a sense also about recruitment, but retention is also really a challenge in rural areas. So when we want to change our focus slightly and think about our new colleagues in rural practice, how do we welcome them and support them with those of them starting out? Similar to with students, it helps to create a welcoming atmosphere where they can feel that they belong. Here are some ideas to keep in mind. So it's good to welcome your new colleagues and make them part of the team, invite them along to whatever is happening, professional socialization within the organization and also the wider professional community. For example, inviting them to a journal club or other local professional development activities and getting to know other colleagues. Also inviting them to social opportunities at or outside the organization, being accessible and creating a supportive team environment for your new colleague, and also letting them have access to shared resources. As a new clinician, it's also important to think what will you do to best settle in and get started in rural practice. So one thing that's very important is to try and be sensitive to the context that you are entering into and being respectful and not trying to change things overnight or to try and change people's minds, but really learning and settling in and respecting the way that people do things in rural areas. Taking an interest in and learning about the community and just being involved in the community in and outside the organization where you are working and getting out there and getting to know people. Thanks, Tish.
Okay, thanks, Elsie. So we've talked a lot and there's lots of information that we've covered. And so now might be a good time just to have a final reflection and just take down a few notes for yourself. And I'll ask some questions and just might trigger your thinking a little bit in your reflection. So maybe write down what struck a chord with you today. Was there something that stood out as being interesting or different, or maybe just what you're going to take from today? Was there anything that you think from today you might do differently? And just write down maybe anything that you would like more information on so that you can either follow it up or ask us for some more information. Like we said at the beginning, we've created a Padlet site which has some more ideas and resources. And on the next slide, there'll be a QR code so that you can scan that. So you can feel free to visit that and contribute there as well. We would really like to hear your feedback, your comments, your thoughts, and have it as interactive as possible. So that's, you can pause and just take a quick scan of the QR code there. Okay, and resources.
Right, so yes, let's talk about resources. We've put together some supervision specific resources. Many of you might know the HETI website. They have loads of wonderful resources, including the STAR program, Clinical Supervision Handbook, some video material on placement models, and many others. So head over there if you can. Another good resource is the BPCLE, which stands for the Best Practice Clinical Learning Environments Framework. And this provides some information on what aspects are needed to ensure that students are received in a great clinical learning environment to make their placements effective. So it just helps for you to think about what can you do to ensure that the environment where students are received is really contributing to great learning. Three Rivers Department of Rural Health, we offer online training, professional development, online modules, and we also have clinical educators in a range of settings who are available to work through any supervision challenges with you, whether this might be when still thinking about having students, or just before or during the placement, or even afterwards. Please contact us and we might be able to help you connect to the relevant people, or address any problems that you might have. I'm also mentioning Going Rural Health. They are our counterpart in Melbourne. They have a great website as well with free online supervision training and resources. But there are many other university departments of rural health in the country, so please go and look for them. All of them offer some kind of resources and support. Then we have resources relevant to working as a rural clinician. So SARA, which is stands for the Services for Australian Rural and Remote Allied Health. They are an organisation who advocate for and supports rural allied health clinicians, and they have some great resources as well, which includes a transition toolkit to remote and rural practice. So if you're actually looking to transition to rural and remote practice, this is a great tool to use. They offer a national conference where you can connect with like-minded people. And they also have a rural generalist pathway, which is being offered through their organization. It's always a good idea to join your relevant professional organizations and local interest groups according to your discipline. Then keeping up to date with research without costing you anything. There is the directory of open access journals, which is a helpful platform for you to search for free open access journals. And this could be relevant to your discipline or in terms of your area of interest. And you could join or start a journal club making use of this resource. Specifically, I want to draw your attention to Rural and Remote Health, which is a quality open access journal, and they publish material by rural health practitioners, educators, researchers, and policymakers. So everything that is published there has to do with rural and remote health. Thank you, Tish. Moving to the last slide, or second last slide. Thank you so much for listening to us. Please check out the other personal development opportunities on our website. And we do offer face-to-face training opportunities on request. So please connect with us and let us know what you need. We also have, on the next slide, we also have some references that we used in the making up of this presentation, but also some that you might look at if you are interested in reading more.
Thank you for listening, and thank you, Elsie.